Hi, my name is Crystal Pfeffer, and I am here to present my strategic plan for reducing rehospitalization rates at PIH Home Health. This presentation has the following objectives. First, to provide a background of PIH Health, then to review the SWOT analysis performed, go over the strategy map, discuss the action plan for implementation, look at communication methods to be utilized during this plan, and finally to review the evaluation strategies to be used. There will be an opportunity for questions at the close of this presentation. PIH Health was founded in 1959 in Whittier, California. It is a regional, nonprofit healthcare organization with 2 hospitals and 440 inpatient beds combined. There are multiple outpatient settings, including physicians' offices, outpatient rehabilitation services, a dialysis center, a women's center, home health, and a hospice, which includes 2 outpatient hospice homes. It is the largest employer in the community. The mission of PIH Health is patients first. PIH Health has a large post-acute care department that includes home health, hospice, the acute rehab center, the transitional care unit, palliative care, and behavioral health. The American Hospital Association has recognized post-acute care services as a growing area within healthcare and the desired setting for patients to receive care in most circumstances. PIH Home Health is a department of post-acute care. There are 2 offices that service Los Angeles and Orange counties with a census of 500 patients. The disciplines offered are skilled nursing, which includes registered nurses and LVNs, physical therapy, occupational therapy, speech therapy, medical social work, and certified home health aid services. A detailed SWOT analysis was performed to identify the strengths, weaknesses, opportunities, and threats to PIH Home Health. The strengths identified are strong customer service skills, a 4-star rating with CMS, integrated hospital-based services, and a physician director who is able to make house calls. Weaknesses identified are that the hospitalization rates for PIH Home Health are high, up to 18%. There is a shortage of frontline staff, a lack of coverage after hours for home health, and the electronic medical record is not integrated between departments within the organization. The opportunities identified by the SWOT analysis are that there is a large population of full-risk patients that PIH Health now has 100% responsibility for financially within the management services operations. The bundled program under Medicare is also an opportunity for PIH Health to develop a comprehensive program for these patients. The identified threats are that many competitors have a better and integrated electronic medical record. Also, the current star rating is threatened by the high rehospitalization rates. The key stakeholders in this plan are the leadership staff, including the CEO, CNO, CFO, COO, vice presidents, and directors. The physicians, case managers, frontline staff, and patients are all also key to reaching this goal. Based on the SWOT analysis, the goal for PIH Health is to reduce the rehospitalization rates by 5% within 1 year. A detailed strategy map was created to enhance the strategic plan. The strategy map developed shows how the goal to reduce rehospitalizations fits into the patient's first mission at PIH Health. Financially, the goal to reduce rehospitalizations is key. Taking care of patients in an inpatient setting is extremely costly compared to the cost of care at home. Also, with reduced rehospitalizations, higher revenue will eventually be received through Medicare and the pay-for-performance model. This goal meets the organization's patient service goals as decreased hospitalizations should increase patient satisfaction and patient quality. Patients will be healthier and happier receiving care at home. The goal helps the internal business goals of the organization to improve communication between departments and improve service. A future goal is to have an integrated electronic medical record. Learning and growth goals will be achieved through educating the home health staff and physicians on how to effectively keep patients out of the hospital and creating a culture of patient safety. The action plan for implementation is based on a management by objectives model. This tactic helps to set and define clear goals with a specific plan for monitoring progress towards the goal. The plan utilizes a 6-step managerial decision-making tool that 1. Recognizes the problem, 2. Diagnoses and analyzes the problem, 3. Develops alternatives, 4. Selects desired alternatives, 5. Implements the plan, and 6. Evaluates the plan and analyzes feedback. The Plan, Do, Check, Act model, or PDCA, will help to ensure patient safety throughout implementation. The plan recognizes a strong need for teamwork between the departments within the organization. The relationship-based care, or RBC model, is utilized at PIH. It recognizes the need for strong relationships with oneself, co-workers, and patients. This model will be critical for success of the implementation plan. There are many contributing factors to increased rehospitalization rates. PIH has identified that staffing shortages, a lack of after-hours nursing coverage, high patient acuity, and shorter hospital stays, as well as a lack of physician support or buy-in, are contributing to the increasing rates. When called with a patient issue, many physicians will simply send a patient to the ER as opposed to attempting to treat non-life-threatening issues at home. Potential solutions to this problem are to increase staffing and recruitment techniques, including incentives for home health. As the hospital is shortening stays, inpatient staff are being flexed. Offering incentives for transferring to home health would be desirable and beneficial. The implementation of an after-hours on-call nurse would give patients someone to call after hours if they are experiencing issues instead of simply going to the ER. Improving care at transitions of care, especially at discharge, is crucial and will help patients have what they need when they go home, including medications and durable medical equipment. An integrated EMR would improve the communication between departments. It is a goal of the organization, but will not be fully met for a few years. Finally, detailed and specific training and education is needed for frontline staff and physicians with specific tactics for reducing rehospitalizations. Both verbal and written communication techniques will be utilized in reaching the goal. There will be formal in-services for nursing, frontline staff, and physicians. Written guidelines will be established for staff to follow. Frequent updates will need to be provided to staff on the progress towards the goal. At quarterly intervals, progress will be monitored as Medicare updates the metrics on rehospitalization rates. An open and transparent leadership style will be used to provide updates on the progress toward the goal. The feedback control model will be implemented as it sets a standard of performance, measures the performance, and then compares the performance to the standard set. If the goal is being met, then reinforcement is given. If the goal is not being met, then corrective action needs to be implemented. This method will utilize a total quality management approach that allows quality to be infused into every activity through continuous improvements to prevent rehospitalizations. Through careful monitoring and ongoing education, rehospitalizations can be reduced and patients can be given the highest quality care at home with the best outcomes. Thank you for listening to this presentation.